This is Meyer. I'm a pulmonologist practicing in Sacramento, California for the last 30 years or so. I'd like to continue this series today on allergic rhinitis or hay fever. Allergic rhinitis basically means allergies of the nose because there's symptoms of the nose that occur when you breathe it, when they get in contact with allergens or things you're allergic to, such as pollen or mold, dust, and danders. Hay fever has nothing to do with hay and has nothing to do with fever, but it might be an all-inclusive better term because of a combination of various pollens, trees, grass, weeds, house dust, molds, which are the winter time of hay fever symptoms versus the spring, summer pollen things. The amount of pollen in the air makes things worse, and some seasons are worse than others, and you see people with more symptoms. The symptoms are not only stuffy nose, but runny nose, itchy eyes, itchy nose, sneezing, tearing, and then sometimes a cough. When you cough, that means the allergens are going down further into the bronchial tubes and you have allergic bronchitis. And there's a continuum from allergic rhinitis to allergic rhinosinusitis, allergic bronchitis, and allergic asthma. Today we're focusing on the top portion there. We went over the type of inhalers you use on a previous session, and so we will go into the symptoms more today and how we can help relieve the symptoms. The stuffy nose and the runny nose and needs some antihistamines, because when you have allergens that hit sensitive areas of the mucous membranes, the histamine is one of the neurohumors that's released. And there's a number of these on the market. They are short-acting and some are long-acting. The antihistamines of former years were all caused drowsiness and were very poorly tolerated. The new antihistamines of the last few years are more sophisticated, relieving some of the drowsiness and pure antihistamines. And we see Zyrtec and Claritin on the market now that have become generic, and the $3 pills, which means $120 a month of a few years ago, have become 300 pills for $12. So from $120 for 1 month to $12 for 10 months is a tremendous drop in price. And of course these are over the counter now, and you don't need your physician's prescriptions for these anymore. The other then there's also long-acting nasal inhalers that last for a longer period of time, and the steroid inhalers. Nasal corticosteroid sprays are the most effective in treating long-term allergens, and they've been around for many years, and they work best when used non-stop. In other words, if you're good one day, you don't miss them, because otherwise the symptoms will catch up with you and you'll have increased symptoms. So those are best to use every day, corticosteroids, and even though the effect may not be very prominent on a regular basis, the long-term effect will be very good. There's also decongestants that shrink up the membranes, but these are somewhat hazardous and can actually cause more trouble by rebound later on. Some of the newer things are Singular, which is a leukotriene antagonist, which has come along in the last decade or so. In fact, we did a singular study in this practice at one time. Allergy shots, which was a mainstay several decades ago, but for the last 20 years or so we've seen very little need for allergy shots. I myself have had allergy shots, take them every week or twice a week for a 3-4 year period. The first time around was very effective, and then it recurred, my allergy symptoms recurred after several years, and the next series of shots was less effective. Now that we have long-acting with no drowsiness antisteroids and antihistamines, these shots have become relatively rare and unnecessary. One of the problems of allergic rhinitis is the progression to allergic rhinosinusitis. You can have infection in your sinuses. As we pointed out before, the sinuses are right around the nasal membranes, and the openings are into the nasal pharynx, and also the openings from the ear. So when the nose gets congested, these openings can congest, and you have sinus infections and also middle ear infections called serous otitis, as the fluid builds up in the middle ear. So prevention, of course, is avoiding the things you're allergic to. So for hay fever and allergies of the nose, most trees produce pollen in the springtime, grasses in the summertime, and ragweed and blooming flowers in the late summer and winter. Of course, here on the West Coast we have no ragweed, but we have a lot more other flowers that are prevalent here. When I was running the allergy clinic at Meyer Air Force Base, we saw many people who had no allergies here, but after they were here for a few years with all the pollen, they developed allergies and had nasal symptoms and a significant hay fever. We saw other people from the Midwest where they had serious ragweed hay fever, and they came to Sacramento and they had no symptoms because we have no ragweed pollen here. So I think that's it for this week, and next week we'll continue on to this further progression down the airway, bronchitis, and so on. One item of the conjunctivitis is, I mentioned the nose and the eyes tearing. The symptoms of the eyes, the clear membrane around the whites of the eyes is a conjunctiva, and so in addition to rhinitis we have conjunctivitis, and sometimes that takes steroids or antihistamine drops to keep that under control. So that's all for now, and we'll be back with you next week.